the emergency room doctor who ended up in the ICU as a patient. Meet the physician fighter and his long road back from coronavirus. Here's ABC's Kaylee Hartung.
Hey, Dad. Hi, Daddy.
For Dr. Grant Lashley, this is a moment he wasn't sure he'd ever experience again. Embracing his family for the first time in over 3 months after a grueling battle with coronavirus.
Oh, I love you.
The 50-year-old ER doctor contracted COVID-19 while working at a hospital in Lafayette, Louisiana. The virus stripping him of his ability to walk and nearly taking his life.
He was left with dramatic life-altering consequences from this illness, and he had to have patience with himself first and foremost.
I told you I'd walk out.
Yeah, that's right.
But today, more than 90 days and 3 hospitals later, he's finally heading home. Dr. Lashley is one of the lucky survivors. More than 4 million people have been diagnosed with COVID-19 across the U.S., with cases continuing to surge in 37 states, Puerto Rico, and the District of Columbia. According to the CDC, more than 100,000 healthcare professionals have contracted the disease, and more than 850 have died, likely after helping patients during the pandemic.
A little more.
For the nearly 2 million patients who've been hospitalized, Dr. Nikola Dragojlovic says many face a long and complicated journey to healing and independence.
Once they say you can leave the hospital, then what? Who's going to help you when you get home if you can't do everything that you could independently? Who's going to get you back to work?
Lashley, a doctor for 15 years, had been working on the front lines of the pandemic when he suddenly fell ill, testing positive for both COVID-19 and strep.
As I was monitoring him, he developed a really high fever and low oxygen saturation.
His wife, also a doctor, at points feeling helpless.
In about 24 hours, he was hospitalized and in the intensive care unit. And about 24 hours after that, he was intubated.
And when you become the patient, it makes a big difference. And you have to say, okay, I'm a patient now. I've got to take off my doctor hat and let y'all do what you got to do to help me.
He would spend 39 days on a ventilator fighting for his life.
What were the toughest days of these last 90 like for you?
They were real difficult. I think the hardest thing for me, there were a lot of days when we didn't know if Grant would survive the intensive care unit.
I'm realizing it was much worse than I'd ever imagined or dreamed. There were discussions while I was in the ICU of, is it possibly time to remove life support?
After fighting off the virus, Lashley sought care in Houston, Texas. His rehabilitation taking place at one of the nation's top care facilities, Tier Memorial Hermann, the same facility that rehabbed Gabby Giffords.
He already had weakness in his arms and legs from losing strength and muscle mass, but then he had a stroke on top of that related to COVID. He was fully dependent upon the nursing staff and the aides to help him.
So you should be good.
1, 2, 3.
Good job.
At Tier, he would begin the difficult process of learning how to walk again.
Just keep breathing, remember? Don't hold your breath.
Small victories on his long road to recovery.
Nice step. That was a better one.
You have to give it your best foot forward and try every day.
100% you're walking out of here. I'm not letting you wheel out. Lean forward.
3, up.
Beautiful. Beautiful. That was the best one yet.
Every new movement a milestone. Climbing stairs, gaining strength in his hands and wrists.
Try and extend some more at the wrist. You're doing good. Hold on. Okay, I'm gonna help you. Now go.
His wife and 3 young children at home anxiously awaiting updates, sending videos of encouragement.
You're the best dad. You're the best dad in the world.
In the 96 days apart, the kids only able to catch sight of their father once.
They were able to see him in the ambulance bay for about 10 minutes on the stretcher.
What was he like when he first came into this building, and what state is he in as he leaves?
He was requiring total assistance to get out of bed, to be able to move. He could not stand, he could not walk. He still had his breathing tube in place.
Dr. Dragojlovic calling his progress nothing short of remarkable.
With time, therapies, treatments, he's now walking. He's getting himself to the bathroom, to the shower. He's gonna hug his family members when he leaves today.
No hands!
One of the factors that contributed to his recovery, he was treated with convalescent plasma, one of several experimental treatments for COVID-19, taking plasma from someone who's recovered and giving it to the critically ill. A process I know firsthand. While covering the nation's first hotspot in Washington state,
we've just seen another person loaded up into this ambulance to be taken to the hospital.
I tested positive for the virus.
I think I've got a lot of quarantine time ahead.
After recovering, I wanted to help, so I donated my plasma.
The golden plasma.
In hopes it would aid in someone else's recovery. For Lashley, getting plasma was just one part of a complex treatment plan.
Yeah, it's a good height.
On his final days in rehab, the doctor would relearn how to get in and out of a car.
About 3 weeks ago, I couldn't take about 1 or 2 steps. So we've come a long way.
Going home presents a series of new challenges.
I've got to start learning my environment, learning obstacles that I didn't know were there before because I didn't have these issues.
After 3 months, we're just so ready to have Dad home, right, guys? Yes.
Who's most excited?
Hey, Dad. Hi, Daddy.
Dr. Lashley, with just the aid of a walker, finally leaving the hospital behind.
Grant, you just walked out of here. How does it feel?
That was my goal. I mean, when I first got here, I could take 1 to 2 steps, and then I'd have to sit down and rest. At first, I was concerned for myself, but after the team here, I said, I'm going to do it. I'm going to walk out of here when I leave.
Good job.
I told you I'd walk out.
Yeah.
How does it make you feel when you were able to see that real progress?
Well, it's heartwarming. It definitely reminds you of the blessings that we have in life. And to see somebody so motivated and work so hard to make such a dramatic recovery, that's why we wake up in the morning and come here and do the things that we do. It gives us real joy.
That joy in the smiles of his children, who wouldn't let him go during our interview.
One at a time, okay? We'll start here. What are you most excited to do with your dad when you guys get back home?
Play with him, go swimming, go on bike rides.
We got a long list. What about you?
Love on him, go eat crawfish with him.
There you go.
Yay, that's exciting.
Season's almost over. We might make some in.
Yeah.
Just in time.
That's
Just
right.
in time.
Just in time.
Just in time.
As cases and hospitalizations and deaths continue to surge across this country, what is the message you want people to hear after your experience with this virus?
When I say that death toll, you know, I know now the impact on families, on people's lives. I think people need to practice the social distancing, wear your mask when you can, you know, wash your hands, be kind to each other. We've got to do that. We're going to get through this. Thank you. But it's going to take some time.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.